Across the Idaho Department of Health and Welfare, teams are asked to do more every day, serving vulnerable populations, navigating complex cases, and responding to growing demands, often with the same resources. To support that work, the department is beginning to use artificial intelligence, not as a replacement for people, but as a new tool to help staff focus their time where it matters most.
Yeah, so we have recently started to talk about how we are thinking about using AI really as a tool in our toolbox to promote more efficient operations and not to necessarily replace staff, but really to augment the work that our staff do.
That focus extends beyond internal operations to the people and families DHW serves across Idaho.
We're also starting to have conversations about how AI can serve as a tool for those who we serve across the state.
For many, AI didn't begin as a strategy, it began as curiosity.
Last year, there was a bill that passed through the legislature that reduced the amount of time between case record or case reviews in the court. Typically, it was 6 months. It got reduced to 60 days. So what that means is we have 3 times as many reports to generate for the court. And that's when I first recognized that we've got to do something different for our workers because we didn't get any new resources to do that.
One of the greatest pressures within child and family services is time, serving Idahoans as quickly as possible while maintaining the highest standard of quality and care.
We had about 52 indicators that we wanted to be able to find in about 2,000 cases. And it was taking people about 4.5 hours per case to be able to find all 52 indicators. It takes about 30 minutes to process all 2,000 cases. We can probably get these kids to move along and get home a little quicker.
What once took weeks of manual review could be done in minutes, freeing employees to focus on decisions, not data gathering. Despite the speed, one principle never changes: critical thinking.
It's really the human loop idea, right? So you want to make sure that regardless of what you're asking it to do, that there's a human either in the beginning, middle, or end, or all 3 spots. You're making sure that it's answering the question that you've asked it to answer, and that's where the human experience becomes critical.
What we're using it for, and I think what people really appreciate it for, is it's a decision help, not a decision maker. So it just sort of leverages them and gives them more power instead of marginalizing them.
As adoption grows, so does responsibility.
One story I really appreciate especially is the folks who are out there doing the training were working through a group on one of the cases they were working on. And as they were going through the indicators, looking at, is this there? Do we know yes or no for this indicator for that family? What they were finding out is that those indicators were telling them what some of the next steps they had to do in the work were to get people home quickly. So it immediately, on using the tool, started making it so people could make decisions really quick on what to do next and find out how to get all that information together to move forward.
How quickly we're starting to realize how powerful this can be in making our work better, making it more efficient. But I'm really excited. I'm excited that our team has really embraced this. Again, as a tool in our tool belt, not to replace our staff, but to make the work that we do, better and more accessible to Idahoans who we serve.
At Health and Welfare, AI isn't just about automation for its own sake. It's about protecting time, supporting employees, and ensuring Idahoans receive the care and services they depend on, guided by people, strengthened by technology.